As a medical doctor, as a woman who is going through this right now, what do we do? Now that we know, what do we do?
Great question. So when I have patients come to me in clinic and we talk about menopause care, I do it in the form of a toolkit.
Okay.
We start with nutrition. We talk about movement and exercise. We talk about stress reduction, sleep optimization. Then we talk about pharmacologic options like hormone therapy, or if she's not a candidate, then other options for her based on her symptoms. Mm-hmm. We also talk about supplements that might be helpful.
So let's take these one at a time. Mm-hmm. Who is not a candidate for hormone replacement therapy?
Very few people, actually. There's a lot of misunderstanding and misconception around who can and can't take hormone therapy. Absolute contraindications: undiagnosed vaginal bleeding. You need to go see your gynecologist. You might need an ultrasound or biopsy. Like if you're having undiagnosed, we don't know why you're not bleeding normally, please go get that evaluated before we start hormone therapy.
Okay.
Because it might be a tumor that is estrogen fed. So we need to work on that. Active breast cancer, shouldn't be on estrogen therapy. Active blood clot, active stroke. You know, once those 6-month markers and the workup for those things have happened, it's a possibility.
Okay.
It's a nuanced conversation, but not an absolute contraindication. Neither is breast cancer.
Wow.
There are certain breast cancers that after treatment,
you could be a candidate.
Now, again, nuanced conversation, risks and benefits coming back and forth. Mm-hmm. A family history of breast cancer, not a contraindication. A family history of a blood clot or a history that you have of MTHFR or some of the blood clotting high-risk blood clots, as long as you avoid oral estrogen, we're not going to increase your clotting risk.
You're saying that even if you have a history of breast cancer, that does not
100% preclude you from having the option. You deserve the conversation. You deserve the option. For each woman, it is a risk to benefit ratio. I don't think every woman is going to choose hormone therapy, but I think every woman deserves the conversation based on modern medicine and what we know now.
So the majority of us are a safe candidate for hormone replacement therapy. What about supplements? Like, what are the supplements that we need to take?
We really should try to get most of our nutrients from food. And we only supplement where there's a gap or you have an allergy and intolerance. And then we go in from there. But when we're talking about the vital things, if I had my top 3 things I would recommend to everyone.
Yes.
Fiber. Track your fiber for a couple of weeks. Get a nutrition tracker. See where you're at. Fiber does so much in our bodies. Number 1, feeds the gut microbiome. That's its food. So that's the prebiotic.
Give me an example of what fiber
legumes,
is. Who?
Legumes. So beans.
Okay.
Beans. So it's a class of beans. Peanuts are actually legumes as well. Typically really high in fiber.
Okay.
Berries, really high in fiber. Seeds and nuts, really high in fiber. Those are kind of avocado, or, that's my go-to to make sure I'm getting my fiber goal every day. Also has healthy fats and other vitamins and minerals and nutrients. Magnesium.
And this confuses me because I'm not quite sure what type of magnesium to take.
Oh, great question. Your glycinates, your tarates, your citrates, and L-theranates are good because they are readily absorbed into the bloodstream. So now we have nice magnesium levels in our blood. There's also benefit, some of them are better than others, about crossing that blood-brain barrier. So the brain protects itself. There's a membrane around the brain that it doesn't have this 100% free flow of nutrients back and forth. It's really selective about what it lets in. So mag-L-thyronate, which Magtine or Neuromag are the brand names, has been studied in SSRI-resistant depression. So antidepressant, resistant depression in patients. They've added in this. It seemed to be helpful. And my patients, followers, it's so helpful for sleep, anxiety. So I'm often recommending that one at night.
And what one was that one?
Magnesium L-threonate.
Okay, so you're saying fiber's number 1, magnesium is number 2. How do you get magnesium naturally?
So pumpkin seeds, spinach, green leafy greens are rich in mag generally.
What's the third thing?
So I'm always looking at omega-3 fatty acids. Omegas are usually found in fatty fish, also in flax. One of my favorite ways, I'll do this little yogurt and I'll have flax, hemp, and chia seeds. So I'm just hitting all my antioxidants, my anti-inflammatory, my fiber all in one. So omega-3s, if you can't get a good source of that, that's a very reasonable thing to supplement every day. One of the richest sources of that is going to be your salmon, your mackerel, your tuna, your fatty fish, your cold water fish. And then I check a vitamin D level on every woman who'll let me stick a needle in her. 80% of my patients, not just low, I mean deficient. And there's a million reasons for this. We don't absorb it very well because our gut health declines. We're protecting our skin from the sun, which is another place. And we're not really creating it in our skin as fast as we used to. So, and vitamin D is a hormone that has a million, processes in the body. So I'm like, let's start here and get those vitamin D levels up because you're just not working as efficiently as you could.
So if you are eating the fiber and the magnesium and the omega-3s, and you're also taking the vitamin D supplement, how do you make sure that your body can actually absorb it or that your gut health is okay? Like, do you also recommend that people take a probiotic?
So I do. They've done some studies looking at probiotic supplementation in women with obesity and hypertension who are also postmenopausal. And there were some really positive results of, it's hard to measure gut health.
Yes.
We don't walk around with stool samples and they're counting the microbes in it. But when you're bloated, when you're having regular bowel movements, how you feel. When we go through menopause and lose our estrogen, the gut microbiome loses diversity. No matter how many probiotics you take or, there are things we can do, workarounds. But the loss of estrogen will change your gut microbiome to the profile of a man's.
Is that why we get a belly?
Part of it. That's part of it. So we know that an independent risk factor for visceral fat deposition, what we call belly fat in layman's terms, visceral fat means inside wrapping around the organs, inside the abdomen. That fat is very different than the curvy fat, than subcutaneous fat. That visceral fat is a marker for cardiovascular disease, diabetes, stroke. And so women who were on the probiotic versus placebo had lower blood pressure and lower visceral fat. Weights didn't change. Calories are still important, but they're not the only thing. But their visceral fat levels went down. So for that reason, I'm like, eat something rich in a probiotic every day. Yogurt, miso, kimchi, whatever floats your boat. If you can't tolerate that, then you want to consider supplementing.
Gotcha. Talk to us about exercise. So what kind of exercise is critical?
I grew up in the 80s. And I was the cardio queen. I did so many step aerobics classes. I taught them. It would make your head spin. I can
actually see that. I would take a step aerobics class with you.
I did all of my exercise was to be thin.
Yep.
And to maintain a certain body shape. That was part of my social currency. And if I could go back and talk to what I tell my children all the time, we need to move our bodies to be strong, not skinny. And that we are chipping away this constant caloric restriction and all this cardio is chipping away at our bone and muscle strength, which we are going to desperately need as we age, especially if you're built like me.
Yeah.
And I didn't pick up weights until I was well into my 40s. And there's never too late. Anybody listening at any age can start weight training. And you should. So I think that getting people to let go of this notion that thin is the way to be and that you're way better off having a little more curves and a lot more muscle is going to serve you in these menopausal years so much better than just being skinny.